Today's lecture is on traditional health beliefs and practices. In this lecture, we're going to be talking about how a person's cultural background really colors the way they look at health, whether it's actually having health or not having health, as in being unhealthy, and what practices they use to be healthy. Culture determines how a person defines health, how they recognize illness, and how ultimately they seek treatment. In the United States, the majority view is focused on Western medicine. So you see a physician and you see other Western medicine practitioners that will help you take care of whatever health issues you're having. But in a lot of other countries and other cultures around the world, there are many, many other approaches that are used that here in the United States may be seen as sort of quackery. Although I think that attitude is changing some, particularly as we have more and more immigrants coming into the United States. As someone who has been a health practitioner myself, one of the things that I've received in my time as a clinical dietitian is training at the hospitals that in clinics that I've worked in on how to deal with people from other countries. And so if you're dealing with somebody from Southeast Asia, it's going to be very different than if you're dealing with somebody from Mexico, just because you need to understand a little bit more background on where they're coming from and what they expect out of a healthcare practitioner, and what suspicions they might have of Western healthcare as well. But I think we have more and more people coming from Latin America, and we have more and more people coming from Asia into this country, and it really has changed how Western medicine is practiced. And there's been a lot more acceptance of alternative therapies in Western medicine than there ever has been before. Folk medicine, as you see here, we're going to talk a lot about that as we go through that. Many times involves a medicine person, a medicine man, medicine woman, a shaman, someone of that stature who does different treatments for people who come to them. Complementary and alternative medicines, this is something that we're seeing a lot in infiltrate Western medicine, so the traditional physician, nurse, and physician model that we have here in the United States. Many people, Americans, use that, but they also may add other therapies that are not quite as traditional. So these are things like maybe chiropractic care, massage, meditation, spiritual treatments, those sorts of things. And in a lot of cases, there's been some good research that has shown that these complementary or alternative methods really complement the traditional Western medicine approach very well. So we're seeing a lot more of that. Traditional Chinese medicine, we're going to talk a lot about that, and Ayurvedic medicine is something that we see in India, and although it's practiced in different places in the world, but its birthplace and where it's practiced the most is in India. And the picture that you see here is a treatment called Shirodhara, which is, as you see there in the picture, the practitioner putting a steady stream of oil on the forehead of the person receiving the treatment. And this is something that you can get in salon treatments now. You can go to a spa and get these sorts of things. A lot of these places that are spa-like or offer a massage, chiropractic, they a lot of times will adopt many of these practices into their business model to attract people in. The main thing that I want you to understand is that the differences that people have in how they address health and health care are colored by something called their worldview. And in this slide, as you see, the worldview refers to the framework of ideas and beliefs forming a global description through which an individual, group, or culture watches and interprets the world and interacts with it. This is a really complex thing. This is a really complex topic, because really what it is it goes beyond the enculturation, where you've got elders teaching the young how to behave and what the values and the belief systems are for a particular people. This is how we act, this is what we eat, this is what we wear, this is our religion, and so on and so forth. The worldview also encompasses everything that has happened to that culture throughout history, throughout more recent history. So if we think of this as, if we take the Jewish people, for example, they have their own traditions that go back thousands of years. But in more recent history, there's been persecution by the Nazis, and just ongoing persecutions. And so that's something that, as a culture, is going to color the way that they interact with the world, the way that they perceive things. That they're persecuted by many, and so that really sort of changes the way that they interact with the world. And you can say that for any culture, any group of people out there, people who've been through warfare, people who've been through famine, people who have been through political or social upheaval. These are all things that are going to negatively, in the cases I mentioned, impact the way that they deal with the world. So these are things that over time, and we talked about culture not being really a stagnant thing, but sort of changing with the climate that these folks are living in. The worldview as the culture, it can be ever changing, and it really depends on what's going on in the world and in that group at any particular time. Obviously, the more the bigger the change, or the bigger the upheaval, the more effect it's going to have on these people. So the worldview influences perceptions about what health and illness are, as well as appropriate treatments. Majority American values are generally shared among accultured peoples, frequently independent of race or native culture. So when we say, we're going to talk a lot about majority American culture here. And the thing about majority American culture is that for a long time, as you saw in the lecture, the previous lecture, we talked about how most peoples in the United States for many, many years were mainly European. And so European values are really what are the longest established here in the United States. That's what is considered normal for folks who've been here for a lot of generations and who have had children and grandchildren, great-grandchildren, and so on. It's become very ingrained. And in fact, one of the things that we'll see is the very earliest groups that have been here, the ones that have been here the longest, certainly those people who migrated from Great Britain and Western Europe Germany and so forth. They've been here for a really, really long time. So that went to establish a lot of what majority American values are. However, that has changed, and it's continuing to change quite a bit, where majority American values based on Western European peoples is not really as important or as dominant anymore. So there's really sort of some growing pains there. But when I talk about majority American values in this lecture and in future lectures, what I'm really referring to is those values that really started as Western European but are changing and developing as we have more and more people coming to this country from other parts of the world, from Asia, from Latin America. And those folks are coming here and they're having children and grandchildren and so on. The longer a group of people has been in the United States, and the more folks there are from those other parts of the world, it really changes what, and is still changing, what majority American values are. So it's interesting to see how that's happening and how that will continue to happen. So really this is in flux. But when I say majority American values, what I'm talking about are folks that have been here. They're not first generation immigrants. They're folks that their parents or their parents' parents maybe were the ones that migrated, and they were born in the United States and are at least somewhat assimilated into American society. So, majority American values are generally shared among accultured peoples, frequently independent of race or native culture. So, again, what that means is it doesn't really matter what your race is or where your ancestors came from. If you are accultured into the majority American values, you've been here for a long time or your whole life, and you've really accepted American values, that also is going to color your view on health care and health practice. So if we take a look at, as you see in this slide, cultural comparison of common values. So we're going to talk about what majority American culture values and considers important versus what we find in many other parts of the world. And for many of you, majority American culture, this is going to sound really familiar to you. Because for many of us it is drilled into our heads. And one of the most common themes that we see, and again when I talk about these, I'm talking about in reference to health care, although it does apply in several other areas, but we'll think about it as in reference to health care for our purposes today. So we see here mastery over nature. So what that means is you may be ill, but we're going to figure out a way to beat it and cure it and kill it and get rid of whatever the problem is. Personal control is really important. If you work hard enough, if you are strong enough, you will prevail. And in many other parts of the world, fate is what's in control. It doesn't matter how hard you work or who you are or what you do. If you are meant to get well, you'll get well. If you're not meant to get well, you won't. And that's difficult for many Americans to swallow. We're very focused on doing things. What can we do? How can we work? If we work hard enough, we will beat this. That's as opposed to we are becoming something else by the experience that we're going through. So it's not really fighting, it's a little bit more in harmony with nature, as you see in the top there. Time dominates. Majority American culture, we're very obsessed with the clock. What time is it? How much time has it taken? It drives every aspect of our lives. And in many other cultures around the world, the clock is not nearly as important as the personal, the investment that you put into personal relationships with others. It doesn't matter if you're late for an appointment. If you're having an important conversation with your grandmother, that takes precedence. I am much more interested in fostering this relationship with this person who is important to me than I am being on time for some appointment. I'll get to that later. Right now, I want to focus here. And for many Americans, that is, it seems irresponsible. And because that's the way that majority American culture is wired. We're driven by the clock. Human equality. Everybody is equal. Everybody deserves the same treatment. And that is, one of the things that we hear a lot here in the United States. It doesn't matter who you are, what your race is, or your color, or everything else. All things should be equal. And, whether or not they are, that's another story. But that's something that is, we hear a lot. In other parts of the world, hierarchy, rank, and status may make you more important. And again, that can be a little bit difficult to swallow, especially when it's a very blatant attitude. That can be sort of a difficult thing to swallow here in the United States, but other parts of the world, it is what it is. In majority American culture, the individual is very important. That same individual who is responsible for him or herself, they're not a number, they're not a group. They are who they are. That individual is very important. And it's important that we make sure that people are referred to individually and by their name and not a number and not as part of a group. And in other parts of the world, group welfare is much more important. The individual is just merely part of a larger whole. And the entire group works for the benefit of everyone. So there is no me, me, me. It's always us and what is best for us. A majority American culture values youth. The younger and the prettier you are, the more valuable you are. And the older that you get, the more, the more you're taking up space. The more that you really are using up resources and you're not worth as much anymore. And many cultures around the world greatly value their elders as sort of a treasure trove of information and experience. And they're very revered and meant to be taken care of by the youth. Self-help. You go into any bookstore and there's lots of self-help. This again sort of goes with the attitude of if I work hard enough and I'm smart enough, I will be great. I will be perfect. I. There's that individual again. Other cultural groups, birthright inheritance. This is when I was born. This is what I expect. And we could go on and on here. Competition versus cooperation. Again, that's that group dynamic versus the individual. Future orientation. We're more focused on what's going to happen in the future than what's actually happening now. We hear all sorts of inspirational sayings. Make sure that you're living in the now, that you're not focused solely on the future, what's happening now, and many Americans are not really focused on that. We're looking at the future. How much have you saved for retirement? Do you have a job you can go to? Those sorts of things. And many cultures are just focused on what is happening right now. And there are some that are focused on the past. We'll talk about that a little bit when we get to the American Indians. Americans can be very informal with the way they address each other, the way that they treat each other. Other cultural groups, very, very formal in, again, address and in manners. Directness, openness, and honesty, especially in a healthcare situation. If something is wrong, they want to know exactly what's wrong, what's going to be done about it, and they want some privacy with that. Other cultural groups, they may not want information, especially bad health information, directly given to them. They may want it given to a family member. Or, they may want to not have that conversation face to face or with eye contact with the healthcare practitioner. Somebody else needs to deal with it. Okay? We're also going to see a lot of spirituality come up with other cultural groups. Here in majority American culture, we're very focused on the material, things that we have, things that we can get, things that we can buy. What do we have? And in many other places of the world, that is not nearly as important. It's more important what your spiritual life is like, what kind of person you are inside, what you're doing to help the group move forward. So I'm going to be very careful as we go through lectures not say that one is right and one is wrong, because it's not. It just simply is what it is. These cultures have developed over really long periods of time, and they are all of the different ways, all the different world views, all the different values are all very correct for the cultures that they represent. But as you can imagine, there are problems sometimes when people migrate to different places. So you have somebody who's coming from Mexico to the United States, their common values of a Mexican person, a native Mexican person, is going to be very different than what we see here in the United States. And a good example of that is that, and we'll talk about this more when we get to the lecture on Mexican and Central Americans, is that that perception of time. Mexican culture is very much focused on the group, and the time and watching time is not nearly as important as it is in the United States, because they're more focused on personal interaction and interpersonal relations, and that's not quite as important here. So somebody who say is going to have a doctor's appointment or a job or something like that, and time isn't that important to them, may come off as irresponsible or lazy, but they're not. They're just, their time, their values are focused differently. And so a lot of cultural stereotypes come out of this that just don't really hold any water. It's like comparing apples to oranges. So it's important to always remember that. Not everybody sees the world exactly as you do. This slide continues the conversation we started in the last slide, where we're continuing to talk about worldview and the impact on health care. And this is even more focused on health and really sort of echoes a lot of the things we were just talking about. Again, in majority American view, we're going to refer to Western medicine as biomedicine, very focused on the body and on symptoms and those sorts of things. We'll talk about that more in a moment. As I talked about with majority American view, personal accountability is extremely important. As I said, the attitude is, if you take good care of yourself, then you're going to be healthy, and if you don't take good care of yourself, then it's your fault if you get sick. And that's pretty much what we think about here in the United States. Preventive care is very important. Make sure you get your checkups, make sure you get all of your screenings, do all those things. If you do that, it's going to help you keep you from getting sick. Patients in the West want a personal relationship and partnership with their medical practitioners. They don't see medical practitioners as in charge of them. They want to be very much part of the care process. Confidentiality is absolutely important. Here in the United States, we have HIPAA laws, which are confidentiality and privacy laws. Nobody gets to know anything about your health without your consent. And patient autonomy is also important. I am in charge of my health care. I have input from my doctor, and together we make decisions about my health. Now, in a lot of other parts of the country, other parts of the world, the view is much different. In many places, fate or the will of God is seen as the most important. If you get sick, it's because of the will of God or karma or supernatural reasons. There are a lot of cultures that believe that ancestors, dead ancestors who are angry, may inflict illness. In a lot of other places, health is also a family concern. So you may have, if you have a family member who is sick, you might have many generations of the family in the office wanting to know what's going on with that patient. Patient themselves in some cultures may actually be very passive in care and not really wanting to take on any role in making themselves better. Because if you believe that fate is the reason that you're sick, there's really nothing that you can do about it. It is what it is. And you can imagine that this attitude does not go over very well with practitioners in Western medicine. They may look at it as the patient is not concerned about their faith, they're not cooperative, they're non-compliant. That was a word that I heard a lot in my years working in clinical nutrition. The patient is non-compliant with treatment. And that may have been because, in many cases, the Western mode of medicine didn't agree with that person's worldview, what they felt was important. So there was a disconnect there. And we see more and more that Western doctors and other healthcare practitioners are receiving more and more training on how to treat people who come from different parts of the world, from Asia or wherever they're coming from, to understand that this Western medicine is not what's normal for them, and it doesn't make sense to them. So it's not that they're non-compliant, it's just that's their belief system. Sometimes the end-of-life issues can be a problem between Western biomedicine and other cultures. If you have somebody who is dying, but the Western medicine can't possibly do something to save them, you might have a family that says, no, this is fate, this is the will of God, don't do anything. Well, in Western medicine, we want to do everything that we can to make that person better. And if it's within the practitioner's ability to at least try to do that, then they're going to want to do that. But to have the family say no can be really sort of frustrating to a Western practitioner. So again, that's sort of a cultural divide that that may be standing in the way. Western biomedicine relies on physical data to tell what's going on with the patient. The practitioners will rely on lab values, on x-rays, on all sorts of other diagnostic test results to tell what's going on with the patient. And in Western medicine, if tests don't find any problems, if everything is normal, then the Western practitioner is going to say, I can't find anything wrong. There's no illness here. And that is very much the Western view on things. If you look at other cultures around the world, many of them tend to look at the body more holistically, and they go beyond the physical. Is there something wrong with the person's mental health? Is there something wrong with the person's spiritual health? Is there something wrong with their emotional health? There are other things that are looked at. And in Western medicine, because they cannot be quantitatively measured, there's no set number range that tells you how good somebody's spiritual health is. It's a little bit more esoteric. It's a bit more, I guess, for lack of a better term, sort of out there. If a Western doctor can't measure something and cannot look at a lab value for your mental health or your spiritual health, they're likely to say that it's not important. Now, to be fair, there's a lot of changes happening in that area, particularly as we look at complementary medicine and alternative medicine. But it's also important to point out that a lot of these alternative therapies that are becoming a little more common, Western medicine wants to study them and wants to put scientific data behind it and studies and those sorts of things. And sometimes there are things that can't be measured, like somebody's spiritual health. It's difficult to try to study that from a scientific standpoint. So it's something that Western medicine is recognizing, but on the whole, complementary therapies and alternative therapies are still generally seen as very subordinate to traditional biomedicine, where things can actually be measured. So as we'll see as we go through when we go through all of our different cultures and our different countries in lectures, we're going to see how many of them employ different modalities to treat illness, including spiritual or magical approaches that may seem sort of wishy-washy or strange to somebody who values Western medicine and that's all that they know, but it's very real medicine in other parts of the world. In the picture here you can see a traditional healer in Uganda treating a patient. This photo comes from the UN, United Nations, and he's actually pressing a horn into the side of this boy's ear to help remove the interference there. So when we talk about biomedical worldview, again, Western medicine worldview, the relationship of nature is mastery over it. We will cure it. We will overcome it. Absolutely dependent on technology and lab values. Health is seen as a personal responsibility. You take care of yourself or you don't. There's no such thing as fate. We have personal control. And if you don't have good personal behavior, that can also very much be seen as a moral failing. State of being is much more on doing. What do we do? We're very active. What sorts of things are we doing to keep our health up? The role of the individual is very important. The view of the individual, as I said, is much more important than the group. The treatment is very focused on the client, very confidential, as we talked about. And the degree of formality and directness. There's a lot of informality in dealing with your doctor, and in the West it's a little bit more because you're dealing with very personal, intimate things that sort of fosters that relationship between you and your doctor. You can ask your doctor all sorts of questions that you wouldn't ask anybody else. And again, in other parts of the world, that is not the case. There's a very formal relationship, and you would never dream of asking your doctor a very personal question about your health. We talked earlier about how majority American culture is really very dominated by time versus the personal interaction that's valued in a lot of other cultures around the world. And there's actually some terms for that I want you to be aware of. Monochronistic and polychronistic. Monochronistic society is what we are here in the United States, again, majority American culture. And people who are in this category are absolutely ruled by the clock. They're run by their schedules, and being on time is held as being extremely important. On the other hand, polychronistic is not run so much by time, but really run a little bit more about interpersonal relationships and the welfare of the group. It doesn't mean that people who are polychronistic don't get things done. It's just that they operate a little bit differently. So again, we see a lot of polychronistic society in many Latin American countries. It's very common in the Middle East, as you see in your slide. They just tend to subordinate timing to those personal relationships. So things still get done, but they get done in a very different way. You can see how these folks migrating to the United States might be seen as not as efficient because they don't operate in the same way. And as I said, you can't really say that these folks are any less efficient. They just have a different way of making sure things get done. And one of the things in healthcare that pops up as is being late or not showing up for doctor appointments. In our biomedicine system, being on time and being at your appointment is really important. That may not be as important for someone who's coming from Latin America. Maybe they're having a conversation with their grandmother about something that needs to be talked about. In their mind, the doctor can wait. I need to talk to my grandmother. So it's a very different orientation as far as time goes. And we're going to see that come up when we talk about different cultures throughout the semester. So let's talk about this big question. What is health? And I have here the World Health Organization definition, a state of complete physical, mental, and social well-being, not merely an absence of disease or infirmity. So that's a very concise definition. However, for a body such as the World Health Organization, it really leaves out a lot of definition of wellness and sickness as it's observed in a lot of regions of the world. It doesn't address a lot of different worldview. In many parts of the world, again, as we'll see when we go through the semester, there are many cultures that have a very significant spiritual or supernatural component to sickness and wellness, and that definition doesn't really incorporate that. So on this slide here, what I put is, as you see, a broader cultural definition of health. And what this does is it takes into account all different societies. It's more encompassing than this very simple World Health Organization definition. So I'll just read these. A broader cultural definition of health may include being in balance with the environment and nature. Next few slides we're going to talk a lot more about balance because that's very important in a lot of healing systems throughout the world. Being in good standing with deceased family members or malevolent spirits. A lot of cultures believe that if your dead ancestors are displeased with you, then they're going to make you sick. and also a lot of supernatural forces out there that if you're not okay with them, you're not in balance with them, they're going to make you sick. Living according to God's will, being spiritually complete. In a lot of cultures around the world, spirituality is an integral part of healthcare. In the United States, not so much. A lot of these Western countries, as we'll see, many of them lean more towards secularity, which means church is really not a part, or spirituality is not really a part of the majority culture, and certainly it's not seen as being important in healthcare. So, but in many parts of the world it is. So we'll talk more about that when we talk about our lecture on religion. Being in balance with opposing forces. So again, that is sort of what I talked about for the first point here. We're going to talk more about yin and yang. Being in social harmony with those in the family and community. And again, that is when we talk about the polychronistic society and valuing those interpersonal relationships. Having good relationships and being in good standing with those who are important in your life can be seen as something that is very important to your overall health and your overall well-being. In the next few slides, we're going to talk a lot about balance, because in many traditional medicine practices throughout the world and healing practices throughout the world, balance is critically important. And it's a very old belief that exists in one form or another across very different parts of the world, from the Middle East to the Far East, and in Europe, and in a lot of other different places. Africa, we see bits of this as well. So in this slide, what we have is, in the first point, hot and cold balance. And it's a very old belief that the body is healthy, is defined as healthy, when everything is in balance. When we talk about hot and cold, there are forces that are considered hot, forces that are considered cold, and if you're too hot or too cold, that's considered to be a disease state or causing disease states. And when you're perfectly in balance between the two, then you're in optimal health. Our understanding of this originated in the Greek humoral system. The Egyptians likely practiced this, as you see, 7,000 years ago. So this is a very, very old method of treatment. There's a Greek physician by the name of Galen who was practicing medicine, and he wrote about something called the four humors in your body, which needed to be in balance. Humor is another word for fluids. So it's an ancient, an older word to talk about fluids. It's not humorous as in something funny. And he defined the world as made up of four different humors: air, earth, fire, and water. And you can see there they were considered: air was cold, earth was dry, fire is hot, water is moist. In the body, he defined another four humors: blood, phlegm, yellow or green bile, and black bile. And so these bodily humors, bodily liquids, if you will, were all defined as either hot and moist, cold and moist, hot and dry, and cold and dry. And the idea was that if somebody was ill with something, the physician would make a diagnosis based on what their humors were doing. Maybe they were running a little hot and moist, so maybe we need to get rid of some blood. Cold and moist, that would have its own treatment modalities. So the goal of the physician was to get all of these humors back in balance with each other, so that you were neither too hot or too cold. You weren't too dry or too wet. You were somewhere in the middle, and when that was achieved, then you were in harmony. If we go to our next slide, we'll see the concept of yin and yang, which is similar. It's also a balancing technique to help keep the body in balance, to make sure that the body is in optimal health. So yin and yang is practiced in many Asian cultures, and again, the goal is to keep the body in harmony and balance. And the two different things there, the yin and the yang, the two different components, are opposites of each other. So much like hot and cold, you want to balance the yin and the yang to bring the body into harmony. Yin, when we're talking about foods, yin is generally considered to be a feminine type energy. And foods that are considered to be yin are generally raw, very soothing, cooked at low temps, not fiery hot or anything like that, very mild, and are white or light green in color. So those things are very yin. Yang, on the other hand, is more masculine energy. So these foods tend to have a lot of calories, they might be very spicy, they might be very hot. Frequently they're red, orange, yellow, sort of fire colors. And if somebody is out of balance, there are a lot of other yin and yang components that go beyond diet. But when we're talking about food, one of the ways to bring somebody back in balance if they are too far on one side or the other is to feed a particular diet to help bring their body back into harmony, back into balance, and back into health. So if we look at the world as a whole and we ask what health is, as you've seen in the last several slides, and you will continue to see as we go through our different cultures, it's really a very complicated question. You're going to get very different answers depending on who you're talking to. However, if you take a look across the world at things that virtually all cultures believe are good for health, there are generally three broad areas of agreement, and you see them on this slide here. The first one is diet. Eating a good diet is pretty much agreed upon as being critical for good health. Now, what that diet may consist of is as different as there are cultures out there. Sufficient rest is important. So getting enough sleep, getting enough rest is generally agreed upon as healthy. And then cleanliness. And again, cleanliness can be defined very differently across the world. But a measure of cleanliness is seen as helpful and crucial, actually, in helping to keep good health. So those are three broad areas of agreement. Just remember that depending on where in the world you are, they may look a little bit different, but most everyone will agree that those three are all important. Here in the United States, we generally agree that a good diet is 3 meals a day, good variety. I put the My Plate slide up there, which is the government's way of telling us how much we should eat. And if you're not familiar with My Plate, you can go check out the myplate.gov site, but it has the plate there with the larger part of the plate has vegetables on it, smaller amount of protein, whole grains, fruits, milk. Very basic. It actually replaced the food pyramid that we used to use. We also consider daily bathing or every other day bathing, just frequent bathing, as important in being healthy. Brushing teeth 2 times a day is considered to be healthy, or more. Some people brush more, but regular toothbrushing is very important in oral care. Regular health checkups and screenings. If you remember, here in this country, majority American culture says that you need to take personal responsibility for your health, and if you get sick, it's your fault. So regular health checkups and screenings are very important. Weight maintenance, very important to be at healthy weight. Avoidance of harmful habits, smoking and drinking, generally frowned upon as a health habit. If you broaden the scope and you look at across the world what other cultures consider to be healthy habits, you get a variety of answers. And I just have a few things on here. Certainly this slide could be very, very detailed and have a lot more information on it. But just as some examples, ensuring an abundance of food. Some parts of the world it's much more difficult to get regular food than others, and so having a regular amount of food that you can reliably eat every day is considered a good health habit. Ensuring foods are acceptable from a religious standpoint. When we talk about the food and religion lecture, we're going to talk a lot about Jewish dietary laws and Islamic dietary laws and a lot of others that eating foods that are in agreement with their religious beliefs is not only important in terms of religion, but also something that they see as keeping their bodies healthy and keeping themselves in spiritual balance. As we talked about, a balance of different types of food, so the yin-yang, hot, cold, moist, dry. In many cultures, that is very important. Having an active spiritual life. We'll see that as we go through a lot of many cultures when we get into Mexico and Central America and into Africa, and we'll see a lot of how important spirituality is to a lot of people in those areas. And bathing can be more or less than the American ideal. Again, cleanliness is defined very differently in other parts of the world than it is here. So it's really dependent on who you ask. How often you should bathe is considered acceptable. When we talk about health, it's also important to point out that how health looks in different societies across the world can be very different. And many of us can look at somebody and say whether or not they appear to be healthy because we're sort of focused on certain markers that will give us a general idea as to whether or not somebody is healthy or not. And a lot of times those markers are correlated with how attractive we find somebody. More attractive, generally, whether or not that's actually true, more attractive many times to our primitive brain says, well, that person is healthy. And traditionally, beauty has been linked to the suitability to reproduce. And so, in our ancient human beginnings, selecting a partner with which to produce offspring was a matter of finding somebody who seemed reasonably healthy and attractive enough to ensure that those offspring would also be healthy, and the partner would be able to reproduce reliably. So again, if you ask people across the world what they would consider a healthy person looks like, the answer is going to be extremely varied. Here in the United States, thinness is valued, but in a lot of cultures across the world, thinness is seen as a marker of poverty and malnutrition. So that doesn't necessarily work in a lot of cultures around the world. Skin color, skin texture, hair appearance, eyes, those are all things that can give cues as to how healthy somebody is. But specific healthy attributes and attractiveness really, really vary by culture. As we'll see in the next slide, I have an example from Mauritania, which is a Western African country. And in this part of the world, thinness is not considered attractive because it's associated with poverty and again malnutrition. So in this part of the world, for a woman to attract a husband, she really needs to be overweight because that's seen as not struggling, well nourished, and someone who is able to be a good partner to produce offspring. So that's sort of what they're programmed to do. Now, here in the United States, we would look at that and say, oh my goodness, this person is obese and they're at risk for all kinds of different diseases, high blood pressure and diabetes and so on. But here, the view is different. So this is all worldview stuff. And I have a couple of examples of body image and beauty cultural ideals from other parts of the world. You see the tribesman there from New Zealand has a tattooed face. And that is something that, that tribe takes a lot of pride in, and it's something that's considered very attractive. Here in the United States, if somebody has tattoos all over their face, they might seem a little bit threatening, and it's not really the norm here. So that's not going to be seen as attractive or virile or beautiful or anything else generally. You can see the tribeswoman from Burma who has the rings around her neck, and this is a tribe that they start from a very young age putting these rings around the necks of very young girls, and they progressively will stretch the neck as they get older and older until they end up with what you see there, very, very elongated neck. If these women actually cannot take these rings off once they're like that, because their neck would fall over and they would asphyxiate. But that is seen as a beauty ideal in that part of the world. A woman with an extremely elongated neck. Again, wouldn't really fly here in the U.S. People would probably spend a lot of time staring at her. But where she is considered lovely. So let's go on to the next slide. When somebody is sick, they have disease, they have illness, there are a series of steps all across the world that different cultures will take to get that person help. In many cultures, the mother or grandmother is the medical expert within the family. They make the decision to pursue further care. We'll see this again as we go through our different cultures, but I would argue that even here in the United States, this is something that happens. If one of the children is sick, it's generally mom who goes in and deals with, is there a fever or do we need to go to the doctor and things like that. So that's something that is very, very common practice across the world. What is different is how we explain why that person became sick. And again, this is something that I've referred to throughout this lecture. These different models here, the patient is personally responsible for their illness, so very Western, very biomedical view. They made poorer health choices, they made the decision to smoke or to drink or to have a poor diet, and so now they're suffering the consequences, and the doctor goes in and does what they need to do to fix it. The environment or nature is responsible for the illness, and that's just the person being who they are, where they are, contracted an illness because of this. So maybe it's allergies, maybe it's lung disease from pollutants, so on and so forth. So there's certainly aspects of that in Western medicine, but we also see that throughout the world. Illness is due to social causes. This is something when we talk about the polychronistic societies and those where the group is much more important than the individual, this is where we see illnesses being ascribed to these causes. You had a fight with your mother-in-law, and there is a lot of discomfort that is being sort of emanating from that situation, and you have become sick because you've alienated yourself from the whole. When the whole group is seen as very important, and you've alienated yourself from it, you may become sick because you had that falling out with your mother-in-law or somebody else in the group. The evil eye is something that you may have heard of, and that little blue medallion that you see in the slide here is an example of an evil eye. You may see people wear these in jewelry. They're usually little blue beads that look like an eye, and they're used in different ways throughout the world. You actually see this in many places around the world. And again, we'll talk about this a little bit more as we go through our lectures. But this can be used to put the evil eye on somebody and bring poor luck upon them. And make them sick if you see some reason to do that. It can also be used as a protective. So if you wear it as an amulet, it may actually protect you from somebody putting the evil eye on you. So you'll see a lot of people wear these for good luck, to keep the evil eye off of them. The supernatural in lots of places throughout the world is considered to be a big part of whether or not you're sick. And we're going to start talking about this a lot when we get into the lecture on Mexico and Central America. The supernatural is responsible for the illness. There are bad spirits out there, or the will of God. I am sick because it's the will of God, and I can't really do anything about that. And traditional healers will also say, we can see what we can do about it, but it may just be that it is the will of God and we can't do anything about it. It is divine. But maybe we can say some prayers, maybe we can do some rituals and see if we can get you back into good graces. So, the treatments are going to reflect whatever the medical practitioners are saying the issue is. So we can get some very different responses depending on where in the world you are. So healing. We've done the diagnosis, we've figured out what's wrong. What are we going to do to heal the patient? And again, the answer is as varied as there are cultures out there. Healing simply alleviates and treats ailments and the experience of illness and may respond to social issues brought about by the illness. So biomedical, Western medicine, the job of our healers are to run the tests, diagnose the problem, and cure it. So that cure may be modern medications, it may be surgery, it may be physical therapy, it may be whatever the physician or healthcare practitioner says it needs to be. That's the biomedical approach. Non-biomedical, in many other parts of the world, you are going to find all sorts of things. You may find lots of home remedies. You may find lots of homeopathy, a lot of things that are different foods or different herbs or different teas and tinctures and poultices and all sorts of things that are given to correct the problem. Chiropractic care, that's one of those things that's sort of a crossover into complementary care with the biomedical model. Hypnosis, massage, a lot of different things there. Applications of physical forces or devices. Again, this can go way into all sorts of things that we see with Ayurvedic treatments, a lot of shamanistic treatments. You saw the application of the horn on the boy's ear who was experiencing illness. Things like cupping. We're going to talk about cupping later on, pulling things out of the body. Again, this could be a very long, very detailed slide, but for the purposes of our lecture, again, I just want you to understand all these different healing practices. Magical religious interventions. Spiritualism is very important in a lot of parts of the world. Offerings to bad spirits or dead ancestors, making pilgrimages. These are all things that may also help the person become better. So this lecture today is really, like all of the lectures that we have in the first part of the semester, are sort of a broad introduction to a lot of the topics and things that we're going to get into as we go through the semester and as we go through different cultures. So keep this in mind as we're going through, because you're going to find a lot of the same themes appearing over and over again. And that's the end of our lecture today.